Today, we are announcing a new partnership involving Abbott and EMED with the goal to bring rapid, reliable testing into the home where the result is delivered in minutes. We have agreed, the state of Ohio has agreed to purchase at least 2 million at-home Binax Now COVID-19 rapid antigen tests that can be self-administered, and individuals can get results in about 15 minutes. Through an agreement with EMED to provide telehealth services, an individual who uses one of these tests can be guided by a proctor and will get the results in minutes without having to visit a testing location. During this pandemic, we've used testing as a tool to identify individuals who are sick, who have the COVID. We've used it to limit the spread of COVID. And ultimately, we've used it to keep our communities open. To achieve these goals, local health departments have been asking for rapid tests to be broadly available in their communities. And this is something that our local health department partners have told us, if we could get more of these rapid tests so that we could decide how to deploy them in the community, we think that this would be very, very helpful to slowing the spread of the virus. If we get a hot spot somewhere, if we get an outbreak in a factory, so we could be able to move in just very, very quickly. And so with this agreement, we're making these available to our local health departments around the state. So this agreement is making that a reality, allowing communities to more aggressively test for COVID-19 than any other time during this pandemic. So as we're going on offense and as we're focusing on the vaccine, we have to continue to do the testing. And this is going to give us a new tool. It's going to give our local communities a new tool. This is a $50 million investment. We have used CARES Act dollars, and this will make testing more broadly available. We've given local health departments some broad guidelines. We've asked them to make the test widely available in their communities, but we have given them flexibility. And we have given them the ability to use them for community-specific priorities. We've suggested, for example, they might use them for first responders to be able to take advantage of this type of testing. We've heard that some communities will use them in their schools. And the bottom line is, though, that local health departments, by using these, the testing will be more accessible than ever, whenever and wherever it is actually needed. So this is fulfilling a need and a request that we've received for a long time. We now have the ability to do that. So I want to bring in by Zoom Dr. Patrice Harris, former president of the American Medical Association and CEO of EMED. Doctor, we're excited to have you on here, and tell us a little bit about what your company does and what role you play when one of our local health departments deploys this and somebody is actually using it. How do you all come in?
Well, good afternoon, Governor. And
afternoon.
First of all, let me say a big thank you to you for your leadership during this time of the COVID-19 pandemic. And as you note, I had the wonderful privilege of serving as president of the American Medical Association early on during the pandemic. Of course, my role here today is totally separate from my leadership at the AMA, but we are so proud, EMED is so proud to partner with you and the state of Ohio. EMED is a digital health company. The platform we developed provides for screened, virtually guided, and that's live virtual guidance for these COVID-19 tests at home, entirely at home, with the results in 15 minutes. And through this very important partnership, we will be able to, as you note, bring reliable, rapid COVID tests to the residents of Ohio based on your platform. We believe this is a model for innovative testing, a great place, a tool in the toolbox to mitigate spread and get the state of Ohio back to school, work, and play. So again, thank you so much for this opportunity.
So is this contact usually done by phone? Is this contact done by by Skype? How's it normally done?
It will be through our platform, which is similar to Skype. The end user will log on to our platform and be connected to one of our live guides, and they will guide them through the process. You know, Governor, I'm a psychiatrist by training, and I know that folks are anxious. And I know that folks, and they've told me, both family, friends, and patients, that if we do these tests at home, they are perfectly willing and glad to have this opportunity to do these tests at home so that they don't have to go anywhere to take the test, but they want to make sure that they are performing the test correctly. And so once they log on, they will be connected with one of our live guides who will guide them through the process from the beginning to the end. And again, with results available in 15 minutes.
Well, that's great. Doctor, thank you for being on today. Anything else you want to tell us about how this is going to work? We're happy to have you here. Thank you.
Well, I just, note, as I think we all note, and by the way, my condolences to the family of the state trooper that you lost. You know, yesterday we lost again over 4,000 lives, and we've lost over 400,000 lives. And so now is the time to go big and go bold. And that is what this partnership is doing. We need to make sure that we get tests in the hands of folks around this country so that they can make sure they are safe, their family members are safe, and their communities are safe.
Well, we appreciate it. We look forward to seeing how this works, and we're confident that it's going to work well. So, Doctor, thank you. Thanks for being with us.
Thank you for having me, and thank you for the partnership.
Thank you.